Hey everyone. In this chapter, we're going to concentrate on a crucial aspect of your role as a CNA, preventing infection and maintaining aseptic technique to ensure the safety of our residents. This is chapter 14. The purpose is to learn the CNA role in infection prevention and maintaining aseptic technique for resident safety. Each individual under your care relies on you to help disrupt the chain of infection. So, an infection is a disease state resulting from the invasion of and growth of microbes in the body. So, minor infections can cause short illnesses, but some infections are super serious and they can cause death. Infection control goes well beyond merely adhering to guidelines. It's fundamentally about safeguarding lives. So, by washing your hands, by putting on gloves, and by properly sanitizing equipment, you are actively preventing illness and preventing and protecting residents from getting sick. This is also preventing and protecting yourself as well as your coworkers. So, in this lesson, we're going to jump into how infections spread, how our bodies defend against them, the roles of standard precautions, the roles of isolation, of surgical asepsis, and how to maintain healthy and respectful long term care environments by protecting and preventing infection. So, have your textbook open to chapter 14, particularly the signs and symptoms of infection and the rules for hand hygiene. You're going to be checking these out later. So, let's begin with the fundamentals. Microorganisms or microbes. Micro means small, and organisms means a living plant or animal. So these tiny living organisms are invisible to the naked eye and they can only be seen with a microscope. And believe it or not, microbes are everywhere. And some are harmless and some are beneficial. The beneficial ones are the normal flora that lives on our skin and in our gut, but others can be detrimental and cause disease, and those are known as pathogens. So there are 5 types of microbes. There's bacteria. Those are often called germs. These are one cell and they can cause infection in any body system. There are viruses. These can cause diseases. They can cause the common cold. They can cause herpes. They can cause acquired autoimmune disorder and hepatitis. Those are examples of viral infections. Fungi that can infect the mouth, the skin, the vagina, feet, and other areas. Protozoa are one-celled animals that infect the blood. They can also infect the brain, intestine, and other body areas. So microbes thrive in warm, dark, and moist environments. These conditions closely resemble those found within the human body. So warm, dark, and moist environments. Inside your mouth, inside your nose, inside your lungs, inside your intestines. That's right. So why is warmth, moisture, and food sources available to them? Well, because we are a living being. And when this is available to them, they can multiply rapidly. So fortunately, the good news is that light and many disinfectants can effectively eliminate microbes. So understanding the requirements of microbes, so what they need to live in, eat, and breed, we can learn how to inhibit their growth. And this is the essence of infection prevention. So antibiotics are medications that kill microbes that can cause infection, but some microbes can change their structures and that makes them harder to kill. And so they can survive in the presence of antibiotics. And so therefore the infections they cause, they're hard to treat. So another thing is a local infection means a small infection in one part of your body, like a finger from a small puncture wound. But a systemic infection means one that has moved to one or more systems of your body. Check out box 14.1 in your textbook. If somebody has a systemic infection, they're going to have some or all of these signs listed in that box. That box is 14.1. So pay attention, be alert to most minor changes in people's behavior because it could be that an infection is taking hold. Report changes to your nurse. Also keep in mind that in elders, healing can take longer than when we were younger. So infection prevention is important. But also, if an infection is acquired, it also can prolong the rehabilitation process. So, independence and quality of life are directly affected by infection. So, here we go. Here's a little chain of infection. Let's check it out. So, this model outlines the steps of a germ, and these are the steps they take to reproduce. And so our steps in infection control is to disrupt this process. So the first place it begins is with the pathogen. This is the germ itself. Again, it's called a pathogen. And it involves also the reservoir. This is the environment where it lives. This can be a person, it can be an animal, or it can be a surface. And so the germ exits through a portal of exit. And that portal of exit could be a cough or a wound. And then it is transmitted via various ways. Most often it's through hands, through the equipment, things are left on equipment, or through the air. And then finally it seeks a portal of entry into a new susceptible host. So this is someone whose immune defenses are compromised. So when we break any link in this chain through practices like hand washing or cleaning or using personal protective equipment like PPE that we've been practicing, or even through vaccination, we can halt the cycle of infection. Figures 14.1 and 14.2 in Mosby give you some further visual references. Keep in mind, infection prevention is a shared responsibility. It often begins with something as simple as washing your hands, and that's why we are practicing it so carefully and so often in lab. So our bodies have a natural defense against infections, but this capacity is influenced by various factors. These factors include age, nutrition, rest, stress levels, health status, medications, and even the presence of disease or injuries. 14.1 is going to help you understand that a little bit more. Older adults face heightened vulnerability as their immune systems tend to become weaker. They tend to have chronic conditions, and then also just being tired can hinder their ability to combat germs. So as a CNA, your role is to help residents maintain their strength by promoting good nutrition, adequate fluid intake, regular activity, and sufficient rest. And all of these things contribute to supporting an immune system. So here's your ticket to class question. Which link in the chain of infection can CNAs most easily disrupt during their daily care, and how? Write this down on your ticket to class slip of paper, bring it to class, and we're going to have a further discussion with that. So healthcare associated infection. This is commonly referred to as an HAI. And these are infections that happen when an individual is getting treatment in any healthcare environment, and that does include long-term care facilities. These infections spread rapidly among residents, particularly those who have weakened immune systems. And the health team, which you are included, must be vigilant in preventing the spread of infection. So what are some common HAIs? A urinary tract infection. You can get them from not wiping properly, not having proper pericare, as well as having a urinary catheter. Respiratory infections are also, as well as wound infections. So prevention strategies focus on making sure that you have clean hands, making sure that equipment is clean, and then also adhering to facility policies for cleaning, disinfecting, and then also isolating those patients who may have an infection that is easily spread to others. So for further insights, check out box 14.2 in your textbook. This outlines some infection control policies that were implemented during COVID-19. And this is a significant reminder of the importance of these practices to keep each other safe. So medical asepsis refers to the practice of maintaining clean techniques aimed at reducing or preventing the spread of microbes or pathogens. So an item in or area is contaminated if pathogens are present, and a sterile item or a sterile area is an area that's contaminated when pathogens or non-pathogens are present. So this can happen through a variety of ways: having dirty hands, having unclean surfaces, and not handling your daily supplies properly. So make sure you wash your hands, make sure you clean surfaces, make sure you handle linens, dishes, and equipment properly. So hand hygiene is the most crucial aspect of this practice. Again, we've been going it over with Credentia, but box 14.3 in your textbook details some more rules for hand hygiene. In the lab, we've been doing hand washing, but also we have been doing the hand sanitizer rubs, and these are part of your skills training. And don't forget the importance of good personal hygiene. Includes wearing clean uniforms, keeping your nails short, tying back your hair, as well as minimizing jewelry. And these small steps, these small habits, not only demonstrate professionalism, but they also help some cross-contamination. So now let's talk about surgical asepsis. This is known as the sterile technique. So sterile means the absence of all microbes. That includes spores. So this is in contrast to the clean technique. The sterile technique eliminates all microbes, including both pathogens and non-pathogens. This is essential during invasive procedures like wound care. So you as a CNA might be helping setting up a sterile field, and then also handing sterile items to a nurse. So once a sterile item becomes in contact with anything non-sterile, a very important rule is that it is no longer sterile. So for the main principles of surgical asepsis, check out box 14.9 in your textbook. We're also going to learn the sterile gloving procedure in lab, so make sure to observe closely and practice diligently in this area because this is important for protecting residents from severe infection. So let's talk about standard precautions. These are essential infection control practices that are applied to every individual every time, since we can't identify who's infected. So body fluids, secretions, and excretions, those can transmit pathogens. Communicable diseases are diseases that are caused by pathogens that are spread easily. So if an area is clean and it's had been in contact with something that's dirty, that clean area is now dirty. Standard precautions are used for all persons whenever care is given. 14.4, box 14.4 in your textbook, these detail out some of these the standard precautions. So wear gloves, gowns, masks, and goggles when they're necessary. Practice safe handling of contaminated items, and practice hand hygiene before and after each interaction with a resident. Always adhere to the facility's PPE policies and never skip any steps. Make sure you remove your PPE in the correct order to prevent contamination. And again, we've been practicing that credential skill in lab. Boxes 14.5 and 14.7 in your textbook outline standard as well as isolation precautions. We do also have signs that we hang outside patient doors that will detail out what personal protective equipment you need to be wearing in going into a room if that is, there's some special precautions that are required. So think about PPE not only as a physical protection, but also as a visible expression of respect. It demonstrates to residents that you're committed to their safety. It's not always received that way, but that is what that act is truly showing. So sometimes folks need to go on isolation precautions, and these are essential for preventing the spread of infections. However, they can be stressful for residents who cherish social interaction, and that makes their emotional support that they're going to receive from you really important. So before putting on your PPE, take a moment to introduce yourself, particularly if the person has dementia or limited vision. Let them see your face and let them hear your voice first. For handling linens and trash, follows those specific procedures for disposing of linens, disposing of trash, as well as other equipment. Use leak-proof bags that are marked with a biohazard symbol if that's necessary. Boxes 14.7 give you some guidance for that. We've talked about specimen collection and transport. So make sure you adhere to established policies for containment and cleaning when collected specimens have been transported, or you are transporting a resident who is on a isolation precaution. Sometimes it means calling ahead to other departments to let them know that you're going to be walking through their unit. In all of this, your empathy and your calm demeanor can significantly alleviate any fear that folks might have with some isolation that they may be feeling due to these precautions they've been put on. So bloodborne pathogens. Bloodborne pathogens are like hepatitis B, hepatitis C, and HIV. These are transmitted through contact with infected blood or some specific body fluids. Federal regulations mandate that all healthcare facilities implement an exposure control plan that has preventative strategies. So that means like a hepatitis B vaccination, engineering and workplace controls, and using PPE, again, referring to box 14.8. So if you've been contaminated or there is a contamination, clean any contaminated equipment properly and promptly using the approved disinfectants. And if glass is to break, never handle it directly. Always use tongs or a brush and a dustpan. If you've been exposed, that needs to be reported immediately. And your swift response not only safeguards your health, but it also ensures that there's proper documentation and proper follow-up care. So a cleaning schedule is required for all facilities, and this includes decontamination methods and the tasks and procedures that need to be done in order to decontaminate an area. So again, never pick up broken glass with your hands. And then also review those OSHA measures for contaminated laundry. These are listed in your textbook. Remember, dispose of regulated waste in closable, puncture-resistant, leak-proof containers marked with a red biohazard label. And don't overfill sharps containers. When they're full, people try to cram things in there. And unfortunately, I do have a dear friend who got a needle stick that way from it being overfull. That's the risk that you're running. So just do each other a favor. And if a sharps container starts to get full, change it out. Make sure that reusable equipment is properly cleaned, it's disinfected, and occasionally sterilized before being used. We have checklists in our facility, so make sure that those cleaning checklists are followed. And then handle unknown materials as though they are potentially contaminated. If you follow these practices, you're going to be demonstrating professionalism and you're going to be maintaining a safe and compliant workplace. So here's our wrap up. Infection control is fundamentally about protecting both health and dignity. By placing a strong emphasis on infection prevention, you are conveying to your residents that their well-being truly matters. This approach not only alleviates their fears, but it also promotes independence and it builds trust. So here's your reflection question. How can certified nursing assistants help reduce anxiety for residents while using personal protective equipment and isolation measures, especially for those who may feel confused or uneasy? Consider how aspects such as tone of voice, eye contact, and small gestures can turn clinical safety into a compassionate experience. So with that, I thank you and I look forward to our further discussion in class.